Hi everyone, welcome to the Lungleng Show. Joining me today is Dr.Jay Deep. He's an orthopedic surgeon currently working for Apollo International in Guwahati. So it's wonderful that he has come on the show again to talk about one very important topic, and that is known as joint pain. You know, a lot of us have joint pains, and we don't know what causes joint pains, and what are the ways to get it treated, and what are the ways to prevent joint pains. We have a lot of joints, in our body, like literally everywhere. So it will be very interesting to just understand from a scientific point of view. Thank you so much, Dr. Jaydeep, again for joining this conversation. So now, as we are planning to talk about joint pains, this kind of topic will enlighten a lot of people. And like I said, a lot of people are suffering from that, almost everyone, like one time or the other. So now when I play football too much, I will get like some sort of a severe pain. It gets triggered. So can you tell me, like, what does it mean by joint pains? What are the joints mostly that you look at?
Joint pain, there are a lot of joints in the body.
Yeah.
So the joints can be different types of joints.
Right.
The major joints are the knee, the hip, the shoulder. These are three major joints in the body, and it's mainly the knee joint that is problematic, and followed by the hip joint, followed by the shoulder joint.
Okay.
These are the three. There are a lot of other joints. Even in the spine there are joints. Even in the pelvis there are joints. Even in your ankle, foot, there are joints in your fingers, in your toes. A lot of joints. So, but one of the largest joint is the knee joint, and there are many causes of the joint pain. So one of is due to injury to the knee joint, and perhaps that was what you are having. That when you play football too much or excessively, you have knee pain.
Correct.
One. Second thing could be a joint pain due to aging. Say one person ages a lot, and say he's 50, 60, 70, his knee joint now deteriorates. Then there is a lubricating layer there in the knee joint. It gets bad, and then you start having knee pain. That's the osteoarthritis. The third type of knee pain could be due to some kind of arthritis. The rheumatoid arthritis, and then SLE-linked arthritis, and the other type of seronegative spondyloarthropathy. Those can cause problems, and even if you have higher uric acid levels, you can have knee joint pain. And there are pseudo gout, and there are a lot of things that can affect your knee. So first, like in your case, knee pain in sportsmen,
Right.
or those who are playing it for fun or kind of thing, not professionally. So what happens is that our knee joint contains a lot of ligaments, and there's a washer-like thing that is known as meniscus.
Okay.
So what happens is that while playing or doing other things and doing high intense activity, those things could get damaged. One thing is that meniscus could get damaged. Other thing is your ligament, this is the anterior cruciate ligament or posterior cruciate ligament, can get damaged. And in football, it's mainly the anterior cruciate ligament that gets damaged. Now, once your ligaments are damaged, once this the knee joint loses its normal integrity. And if your ligaments are damaged, that means the knee can move much more than it would be if the ligaments were there. So it causes excessive stress on the rest of the joint. So if you have this meniscus tear, so what happens that every time you move on knee, forcefully the meniscus gets rubbed, the joint becomes bad, and also you have severe pain. So these are the type of injuries that can happen. There could be lateral collateral or medial collateral ligament injuries. So these are the things, or sometimes your patella can move out, and that can cause joint pain. So basically, if one of the things is that prevention, how to prevent it.
Correct.
First is human body tissue doesn't get get its full strength immediately when you start playing. So it needs a period of warm up.
I see.
Particularly, your body temperature increases. You have some activity, mild activity of the knee joint or any other joint. It warms up, the tissue gets its proper strength, and then now you do your exercises or sports, and the joint will be much more protected. So warm is very necessary. Don't do cold starts, like sudden.
Right.
Means after say 1 hour inactivity, don't do sudden movements. These are more prone for injury.
Wow. So I want to know, like, how does our warm-up impact the strength of the tissue and bone?
Yes, because the tissue is not like something like it's a living thing.
Yeah.
So living thing, once you do warm up, lot of blood flow increases. The strength, the muscles get toned up. Because see, the muscles, if they're in resting state, they don't have that much strength. Once they are toned up, they get much more strength. So if your muscles get strengthened, your ligaments get better with a few minutes of warm up, the chances of injury are less.
Now, relating to that, when people have pain in their knees, they spray some sort of a sprayer. I mean, they have a spray, and even they apply ointment and so on, like the ointment and stuffs. I mean, it just doesn't make sense to me. How does it help?
See, basically, what does the body do is body has this natural healing mechanism.
Okay.
Body has its own mechanism. The thing is putting the spray, etc., is to bridge over that period of pain.
Okay.
Your pain is bridged over. Your body takes care of your knee. Slowly, your knee becomes less painful. Perhaps if you didn't put the spray, it would also heal, but it would take longer. You will feel more pain. You will be in more suffering. Another pertinent thing I would like to talk is about proper training techniques.
Okay.
So if the training is not proper, like warm-up is not given, if you are using unusual techniques or risky techniques, you tend to have more injuries. So see, like constant training, you should be very, in a scientific method, it should be done with proper strengthening of the muscles and proper care. Then the chances of injury is less. If you do a training in an improper manner, the chances of injury are much more.
Correct. That's for sure. That's for sure.
Another thing is that what is done after you have some kind of injury.
Okay.
Take rest. That's the most important thing. Body heals by itself. If you give some rest, put some ice, put some crab bandage, most of the small tears and nicks and touches get okay by itself.
Wow.
What if that pain is very severe, etc.? Then you should go to a doctor. Say, like if you have an anterior cruciate ligament injury, you have very severe pain. Say after 10 days your pain is gone, but you never bothered to have it checked up, and suddenly you start playing, there will be much more injury.
Yeah, right.
So you will have much more slowly, your knee will get damaged. And it might happen that when you are, say, middle-aged, 40 years, your knee might be so bad that you might require a surgery, the knee replacement.
Wow.
So that thing is very important. So if you have this thing, then diagnosis and then proper treatment. That is very much important. You should not ignore your injury and keep on playing.
That makes sense, totally.
Because not all the pain is in your head.
Right.
Sometimes they're in the knee itself.
That's true.
So
That's
give
true.
proper care to your knee, etc.
Yeah.
You will have better.
For someone who doesn't do a lot of exercise, what is the main cause of knee pain, knee problem?
Yes. It is seen that the more you move your knee, the more the nutrition, the joint gets nutrition. Because this joint layer is not supplied by blood, and there is no blood supply there. So it gets it from the knee fluid, that is synovial fluid.
Wow.
The more you move it, the more circulation that happens, the better. Till a limit. Till a limit.
Yeah.
If you overuse it, then again you will start treating. But generally, moderate exercise is very good for your knee joints. Walking 2 kilometers, etc. is good. But if you start walking 10 kilometers, then you can have problems.
Yeah, it's overstressed again, right?
Overstressed again. So you have to know for your individual part, somebody like they're kind of professional athletes or soldiers, etc. They constantly use that, but their genetic makeup is such, their age is such, so they don't have problem. But someone might be less, not that active, might be sedentary. If they try that activity suddenly, without say 6 months, 1 year of pre-training, they will have problem.
Okay. I think our body is just wonderful. I mean, I really enjoyed the way you explain. There's no blood in the knee. It's just like the fluid that works on it. It's just wonderful. So when you do a surgery on knees, like, how does it look? What do you find?
See, there are 2 types of knee surgery you can do. One is by arthroscopy, and then we place small tubes with a telescope inside it, and you can see the knee joint. This looks very pristine. It's white.
Wow.
The tissue comes in. You can see one blood vessel. It's very good to look at. And there is an open surgery, say for total knee replacement, etc. We can see all the structure there itself. But for total knee replacement, we have to sacrifice most of those structures and put like a knee cap covering, like your tooth cap, a metal covering of it, so that it moves on that metal covering.
Wow. So once our knee is affected, you're talking about knee replacement. What does it mean to what extent does it mean, like, to what extent knee replacement? Is it totally replaced, or like, how does that work?
See, there's this moving joint surface that is replaced with steel and polythene sandwich in between.
Okay.
So steel or there's titanium, cobalt chrome, and this is so. One must remember it's kind of substitute for the real knee. It's never a real knee. So there are certain limitations. But for some person who is say 50, 60 years old, had been very severe, having severe knee pain, that's a very good option.
Right.
But with that knee, they should not expect something of a result of, say, 20-year-old knee. When they in their youth, they were dancing, they were running, they're doing this, doing that. That knee they cannot get. Okay. That knee, what they will get, they will be able to walk for, do their daily activities, etc., climb up and down stairs, few stairs, cases. These are okay.
So despite the advancement of technology, despite the solutions that we have, I am right now feeling that it's always best to maintain the natural one that we have, right?
Obviously, it's always the best to have it. Obviously, but sometimes if it gets damaged, then there are options. You should not be very stubborn not to accept those options.
Correct.
If your condition permits that. As such, and from knee, I would like to talk something about the hip and then shoulder. Hip joint is also another joint from which suffers from a lot of problems. It can the same thing in the knee. There can be osteoarthritis that the knee, hip joint can get damaged. Sometimes post-COVID, particularly after COVID, we have seen that is called as avascular necrosis of the hip joint. The blood supply to the hip joint, the rest of the blood supply to the bone gets dried off. So now if the blood supply is not there, the bone becomes weak and the bone starts to collapse along with the lubricating surface. Now you have very rough kind of joint. It's like if you are moving on a smooth road, now you encounter potholes, now what will happen?
Yeah, right.
You will have a bumpy ride. Similar, that hip joint becomes bad. So there are certain things that we can do. There's certain surgeries. There's again a total hip joint replacement surgery. In some patients, it does wonderful. Might be with the knee, there's limitations. With the hip, there are also limitations, but hip is much more forgiving.
I see.
It's much more, people who have properly done hip replacement, they don't feel that they have an artificial joint in the body. Okay. But knee, they sometimes feel. But
right. Because is it because knees have like a lot more pressure than the hip?
Yes, and also the surface. If you see, the knee joint is a flat surface, and on top of it there's a ball. I think it's a very complex geometry.
I see.
Hip is rather a ball and a socket. A much more simple geometry. So with that simple geometry, it's much more able to replicate the natural thing.
Right.
In this knee, we are not able to replicate exactly the natural one, but close to it. We try.
Okay.
Lot of changes of things have taken place. So
because our knees have to keep bending, every now and then. Hips,
they also bend.
Like, is it?
Yes.
But without much pressure.
No, there's a lot of pressure, but the joint geometry is such.
It's different.
It's different. Because knee we require it for climbing, hip might be other things. So hip is much more forgiving. Then we have another joint, that is shoulder joint.
Shoulder, correct.
The shoulder joint could be involved because, see, it is not a weight-bearing joint like your knee or hip.
Sure.
We generally don't use our shoulder to move about.
Yeah.
But still, it's very, there are certain things that can happen, and particularly with sports, with injuries, and then with aging. There are a lot of things can happen.
Right.
One of the things is frozen shoulder. There is a shoulder joint having pain. It is particularly seen in diabetes, patient who are diabetic, patient who have injury, and sometimes we don't know the real cause, why it takes place. And it's a very, very discomforting pain for the patient. It keeps on unrelenting for 4 months, 5 months, 6 months. The pain, the patient has so much of pain that he or she cannot sleep at night.
Wow.
And he or she cannot lift the hand. So a lot of patients have those problems. There are treatments regarding that. There is a standard.
Even diabetes can cause that, right?
Yes, diabetes can cause this.
Wow.
Then do you have other joints like the fingers? Sometimes you have arthritis. That's a rheumatoid arthritis.
Right.
It's a type of thing like what is rheumatoid arthritis? Is a kind of autoimmune disorder. What is autoimmune disorder? See, if you have bacteria that's come into your body, there's something in your body that will prevent it to come. If a coronavirus comes, there's something in your body that will say, don't come, we'll kill you, this virus. So that is the defense mechanism, the immune system of the body. Now, what happens in this type of problems, autoimmune disorder, is that this immune system now means rather than destroying the foreign things, start destroying their own body. Means they don't recognize that this is our person. They start attacking those tissues.
Okay.
So particularly the tissues that are involved are mainly the joints of the fingers. It could be knee, hip. There's other certain things like even your heart could be affected, even your kidneys, liver or brain could be affected. Very rare. Mainly it's the joints that are involved. So now if you have that, is a cause of joint pain where the person is not causing anything for the pain, but it is because of genetics, etc. She will or he will have lot of pain. Nowadays, with modern medicine, particularly since 2000, year 2000, you can say, in the last 25 years, lot of new medicines for this type of arthritis, autoimmune arthritis have come, and we are having very good results. People who have been earlier crippled, they could not move, their joints would be deformed. Now they are leading a very normal life. But the problem with this type of arthritis is that they have to take a lot of medicines for a long time. And this is what I felt personally, our patients don't take those medicines for long. They will take for a few months to get better, drop it, then go to some quack doctor, Baba or something. Because there is the action of this medicine keep on. After stopping, say, for 1 month or 2 months, they will not feel any pain. After that, they will start deteriorating, and now they are in a state that the earlier medicines won't work. We have to start with even higher medicines. So this is a very big problem, and through this channel, I would like to talk to all that if you have arthritis, don't stop your medicines. Ask your doctor before stopping your medicines, because that causes a lot of problem. And this is it's a common human tendency. Nobody wants to take medicine for long. Who wants to be tied to a pill box?
Correct,
you have a lot of pills in the box. Who wants to try to? But
I hate medicines.
So it's everybody.
Right.
Rather than taking medicines, the taste, cost, etc. It's that thing that you have to remember. Get the supplies from the shop. Keep it there.
True.
Take one by one. So it's an added liability.
Correct.
So, but
mentally.
So that is why I feel a lot of patients stop taking their.
But it's good to complete the proper course, right?
Might be the course might last for years. That's the big problem. It's like diabetes or hypertension.
Like TB.
TB is another thing.
Okay, now see, in our context, in a tribal community like ours, we have something called traditional healer. When your shoulder is dislocated, knee dislocated, they could just, fix it. How do you assess that from a scientific point of view?
See, not all of those things are bad. Perhaps they used to do an important role when there was no modern medicines, medical science available. There's no doctor, no health center, no proper X-ray. But nowadays the things are getting better. So I think now one should be very careful in using those things. They have been providing some kind of treatment for all in very remote places, but nowadays that equation is out.
I see.
The modern thing. So if there is a very kind of problem that's very like your shoulder dislocation, it's better to go to an orthopedic surgeon. There's a lot of things involved in it. They're much more able to grasp what is the problem. There could be tissue damage, there could be fracture with it, there could be something in this that could recur again and again.
Right.
So there are a lot of things they can help.
Correct. One thing I don't understand is for dislocation of joints, how does the modern medicine deal with it? That's something.
No, dislocation, that part of putting back is just like they do. There are particular positions, but it is what happens with the shoulder. See, if the shoulder is dislocated, it's not the bone getting away from one bone to other.
Is it?
It is the tissue that are getting damaged, the additional tissues.
Achha.
When they move, a lot of tissue tear and damage.
Right.
That is what we have to assess. Okay, that tissue tear and damage might not be assessed properly by a traditional healer. That assessment requires. These are the things we say, no, this is a shoulder dislocation that can cause problem in future. This is one thing. This is a kind of, say, if it is dislocated that way, this tissue are damaged, that means you are bound to have recurrent dislocation again and again.
Right.
Nobody wants to live with that.
Yeah.
Anybody will, if they put in a particular position on the hand, they'll start dislocating. Now that's a very big embarrassment for them. Very big. Means they were ready to go somewhere, some picnic, somewhere. Now the shoulder started, had a dislocation. Now they're off. So there are things that can be done, surgeries that can be done for that.
So it's not the bones, it's the tissue.
It's the tissue and along with the bones. So if you have access to a good doctor and you are kind of connected to a hospital in an urban area, and then I think you should go for a doctor per se.
Well, that's wonderful. I think these are all new things. I mean, a lot, because we don't really dig into the issue and the topic. Having conversation like this and just just having conversation with someone who has the experience and the specialization and the knowledge, it's always enriching. I'm sure this will help a lot of people also, not just me, not just you and I, but our
yes,
viewers.
It will help a lot. This is the content that is coming up from our part.
Correct.
So it's local. It's quite relevant to what happens here. It's quite relevant to what bone setters. It's quite relevant here. There are a lot of bone setters.
Correct. This is the last question. Like, sometimes people have the biggest fear is jaw dislocation.
Yes.
And they can't do anymore. Like how do you deal with that? How do you treat?
See, joint dislocation, jaw dislocation, of course, because there are two joints here.
Yeah.
These are known as temporomandibular joints.
Okay.
Some people have some kind of shallow joint. They tend to dislocate more. And particularly if you are laughing widely or you are yawning,
correct.
you could have dislocated. So it's a very easy procedure to relocate it back. We just come from the behind, push the jaw, it sits back. But what happens is if it occurs repeatedly, then you start having problem in the jaw.
I see.
So now you cannot eat tough things like sugar cane or something like chew on roti, etc. And that can cause problem. So, and there is also a type of arthritis known as ankylosing spondylitis that involves those joints. They are more prone to have pain there.
Wow.
So it's not related to dislocation per se, but they can have so.
Wow. Well, this topic is so deep and vast, but thank you for shedding light on it briefly. So thank you so much for this. Really appreciate you, doctor.
Thank you.
Yeah.